Dr. Doug Lucas here, retired orthopedic surgeon, now focusing my practice on bone health and osteoporosis. A little bit of a different video today. So instead of diving into a topic on bone health, I want to give a little bit of time to a topic that has been coming up recently in our comments on YouTube and other platforms. And it has to do with the history of optimal bone health. Why did I go from being an orthopedic surgeon to being a specialist in osteoporosis and prevention of osteoporotic fractures? I think it's important because when you're listening and looking for advice online, in particular on YouTube and other channels, it's tough to know who to listen to and who to believe when things start to not agree with one another. And let's face it, in the realm of nutrition and exercise and supplements, we don't all agree. I'm not saying I'm always right, but I think it's important that you understand what my background is, where I'm coming from, and how we've developed this group of experts and where our recommendations are coming from. So stick around. I'm going to talk about how my practice went from being an orthopedic surgeon and focused on treatment of fractures to preventing fractures in the first place and how we built the team around that. So stick around. So for those of you who have not watched videos of this channel before, don't know anything about me, my name is Dr. Doug Lucas. I am a board certified orthopedic surgeon, but I left the traditional medical model about 3 years ago to pursue my own practice and wanted to manage patients and treat them in my own way, in the way that I felt like they needed to be treated. In order to get to that point though, I had to get some additional training. Where I stand now as a double board certified physician, also board certified in anti-aging and regenerative medicine, hold the status of fellow in anti-aging and metabolic medicine. As a double board certified physician, I feel like I am very well educated in the space of which bone health really resides. And I'm going to talk to you about how we get into that. You may have heard me talk about our 4R method, which is our framework for how we identify or recognize how people are losing bone, reverse those causes of bone loss, retest to make sure we're headed in the right path, and then help patients revive their life and live without the fear of fracture. That is the framework we start with in OBH, but that's not where OBH started. So let me give you a little bit of background. I'll spare you the background of what got me to medical school. That's a story for another day. But I chose to go to a DO school, or a doctor of osteopathy school, because I liked the idea of treating patients through the lens of a holistic picture. There are 4 tenets of osteopathy, and one of them is that the body is a unit. And it really made sense to me that we should look at the body as a complete structure with everything being related. I also love the idea that as a physician, all we're really doing is removing the obstacle that's preventing the body from healing on its own. And I think that we have really lost that in our medical community, in our current society, because so much of what traditional doctors are looking for is a diagnosis and a treatment, but that treatment is no longer just removing the obstacle, it's just treating the symptoms. And so I really latched onto this idea of functional medicine later on. But early when I was looking at what my path should be, none of this had made itself apparent to me. So I liked the idea of going to a DO school, and for those of you who don't know what a DO is, I mentioned it, Doctor of Osteopathy. In the United States, it holds the same licensure and all practice rights as an MD. We go through almost identical training at this point. The biggest difference is the DOs still learn manual manipulation. So some DOs, very few, still practice manipulation with their hands, kind of like what a chiropractor is trained to do. Some differences there, but actually similar origins, which is an interesting story. So I went into the DO program. I learned all the traditional medical stuff. I was almost immediately turned off of the idea of using drugs to manage symptoms of disease because it just didn't make sense to me. But like almost all medical students, I was really indoctrinated in the power of pharmaceuticals. Fortunately for me at the time, I also found out that there are other ways that you can treat people in the traditional medical model, and that was with surgery. I really fell in love with the idea of treating people with a very clear pathway, being able to take a clear problem, particularly in the realm of orthopedics, a fracture, and you do a thing, which is to allow the body to heal itself, and then you watch the body heal. And I loved that, and I trained in that, and it was very competitive, which also was interesting to me. And I went down that pathway, and I got into a great residency and ultimately trained as an orthopedic surgeon. I finished my training at Stanford University with a fellowship in foot and ankle orthopedics. And I chose foot and ankle because I recognized that in some of the subspecialties, particularly joint replacement, sports, there was great research that showed physicians and patients why we do what we do. In foot and ankle, that research was really new. It was lacking quite a bit, and I was involved in the research committee at the American Orthopedic Foot and Ankle Society early on because I wanted to help design this research and be involved in this, not as much from an academic side, but more from a private clinical side, to help to bring that realm of practice into really the research model. And we did that, and I was part of some really cool programs to help get those things off the ground. However, even though I felt like I was doing a lot of good in the trauma space, in my early practice, and I have a funny picture here from when I started, this was back in 2015. In my early practice, I felt like I was doing a lot of good with trauma. We were fixing fractures. In my elective foot and ankle practice, I really felt like I was kind of chasing my tail. Most of the patients that I was seeing had chronic issues, whether it be arthritis, diabetes, pain syndromes, chronic deformities, deformities that resulted from either being overweight or imbalances. And so many of those things had to do with chronic metabolic issues that had started decades before. I had a strong interest in nutrition out of the gate. My wife, Dr. Ashley Lucas, is a PhD and a registered dietitian, and ultimately ended up starting a company in weight loss called PhD Weight Loss and Nutrition. And I watched what she was able to do through nutrition, and I wanted to help educate patients with the information that I knew about nutrition as well. But what I learned very quickly is that patients that are seeing me for pain that has been caused by decades of some kind of dysfunction or bad nutrition advice or whatever the chronic thing is, they're not necessarily there to hear me talk about nutrition. Not only did they not necessarily want to hear it, but also the hospital system, the practices didn't want me to talk about it either. And ultimately, I was there to fix fractures. So pretty quickly out of the gate, I realized that I was probably going to be fighting an uphill battle. About 3 years into practice, we decided to leave our initial practice location of Durango, Colorado, to Asheville, North Carolina. We moved there to help expand my wife's business, and I also found an opportunity at a wonderful practice here in Asheville, North Carolina. There was a private practice model, and I thought it would be a better fit because I felt like I would have more flexibility. What I didn't know is that the amount of trauma that I would be doing, taking call at a high-level trauma facility, very busy, seeing a lot of fragility fractures, as well as the demands of a busy private practice, would actually take me further away from what I wanted to do, which was to be able to educate and create a pathway where patients could get more information. During both of these scenarios, I would watch patients with fragility fractures come in. So those patients with osteoporosis that would go on to have a spine, hip, wrist, upper arm, pelvis fracture. I would watch these patients come in with those injuries, and we would operate on them when needed. But then after we would operate on them, there was really a paucity of opportunity for them to get what they were looking for when it came to treatment. In Durango, we actually had a really nice fracture liaison service, which helped to identify fracture risk and did a good job of providing medications for patients that were open to it and were candidates for it. And that is a nice model for an orthopedic practice. In Asheville, we referred people out, and there were resources in the community, but what I found is that most people didn't find their way into those resources, and they ended up coming back to me. And when I would ask them what they were doing about their osteoporosis, the answer was nothing, for the most part. So I would share with them what I share with my patients now, which is the bone quality that they had to suffer a fragility fracture is going to be likely a limiting factor in their health span. It is likely going to, if it hadn't already, change their lifestyle for the worse, and could actually end up being a cause of their death if they were to have a hip fracture and develop the side effects and comorbidities from that. So I would then start to try to educate again, and then I got stuck in the same cycle. I actually received a notice from our malpractice carrier when I was in private practice that told me to stop talking about nutrition because it wasn't in my scope of practice. So I got very frustrated that I couldn't practice the way that I wanted to, and ultimately in 2019 decided to make a change, and I left my private practice. I went part-time with the local hospital system, and that allowed me the opportunity to get more education. That's where I did a fellowship in epigenetics. That's where I did a fellowship with A4M in anti-aging, metabolic, and functional medicine. That's what led to my board certifications and the status of fellow that I mentioned earlier. That information, that knowledge base gave me it empowered me to feel like I could do something more. I looked for different ways to practice. I looked at functional medicine practices, integrative practices. Precision health was a cool thing that was really kind of just coming out then. But I knew that based on what my wife's experience was in her business, that in order to make change, we needed good coaching staff. We needed educated RDs who were open to a different form of nutrition education and management. We needed a team that could really help to impart all the things that I knew that my patients were needing and looking for. And so ultimately we decided to create our own thing. And so we created initially a program called Optimal Human Health. And Optimal Human Health is a platform where myself and other physicians could put together a team so that we could treat people through the framework that we all kind of decided on together, which is this pyramid of optimization. Now, what I love about the pyramid of optimization is that it's a framework that helps us to differentiate the way that we manage patients from the way that the traditional medical model manages patients. So osteoporosis is a great example, because if you look at what even that great fracture liaison program that I was talking about, typically they're going to identify that somebody has a disease and then they're going to recommend pharmaceuticals, right? That's the whole point, is to help prevent fracture by recommending the right drug. The optimization pyramid, though, should be flipped upside down. And the reason why it should be flipped upside down is that you really need to focus on the foundation first. You need to focus on the lifestyle things, the right nutrition, the right movement or exercise, making sure that you're getting optimal sleep so that all of your systems are functioning well. What does your spiritual health look like? Only then should you then take that next step and talk about what the right supplements are. Those should be directed on biomarkers, genetics, and other testing. And then the next step should be hormone optimization or potentially replacement if somebody's a candidate. And then the next step should be advanced tools like peptides. And then, and only then, the next step should be pharmaceuticals. And I love this framework because you can use it for osteoporosis, but you can also use it for other diseases which are not well managed by our system, which would include things like diabetes, cardiovascular prevention, dementia prevention. Honestly, most of the top 10 killers of US adults actually fall into this category of things that our system can treat once it occurs, but doesn't really help to prevent it. So what about optimal bone health? Well, very quickly after we started Optimal Human Health, we started getting consults for people that had osteoporosis and wanted that to be their primary goal. I already knew that that framework, the optimization pyramid, was perfect for these patients, but we hadn't really done the research to figure out how specifically we can tweak it to help optimize bone health. So it was very simple to make those changes, get some additional lab work like bone turnover biomarkers, and a few other things to rule out secondary causes of osteoporosis. And then all of a sudden now our health optimization pyramid actually blends right into the 4R method. So when we say the 4R method of recognizing why you're losing bone and then reversing those causes of bone loss, that second R is actually the entire pyramid of health optimization. And so they blend so beautifully together that we realized, hey, we should start telling people about this. And that's when we ultimately started reaching out and starting to do videos and content about optimal bone health. Because really, this is how patients should be treated with osteoporosis, in my opinion. And ultimately what I'm finding is that it's what they're looking for. You know, whether it be the full service program where you're working with us as physicians, or you're doing more of our self-guided or group coaching options, but getting information that helps you to build your own optimization pyramid, starting with the right foundational information, figuring out which of the the talking heads on YouTube, like myself, Instagram, and other digital avenues are giving you the information that's right for you. And so this has become our goal with Optimal Bone Health, is to really help people to get educated so that they can get the things that they need. And ultimately, for the patients that need our help, to dive deep and to get them out of the deep hole of poor bone health and get them in the right direction and improving not only their bone health, but also their health span overall. Those are the patients we really love to work with. So I feel very grateful for the opportunity to be here helping patients, educating people through platforms like this. Really feel like I've found my stride and that this is where me and my team needs to be. So I hope that makes sense. I hope that the training that I've gone through is what you're looking for in somebody who's giving you advice on all of these things. Know that a lot of this content doesn't just come from me and my training, it actually comes from my team. We meet regularly and talk about these topics. We talk about gut health. We talk about what kind of testing is right, what kind of functional testing is right, what kind of tools we can use to optimize hormones and not just replace them. And if we are replacing them, what's the right avenue and how do we mitigate risk? So this has become really a great team approach. Most of it comes from me to you because we want to keep the channel consistent. Ultimately, we want to serve you in whatever capacity you feel like you need. I believe that we are meant to be better as humans. We are meant to live better than we are. And the team that I've built is passionate about helping people to do that and putting people on the right path. So thanks for listening and making it to the end of this video. If you like this content and the other content on our channel, please like, subscribe, and sign up for notifications. If you know anybody that would benefit from this, please share this with them so that they can continue to learn on their own bone health journey. If you want to learn more about what's going on at our practice, there should be a link up here in the video. You can click on that and fill out a form, and it'll send you on the right path to learn more about how we manage patients. And lastly, I want to hear from you. Please leave comments, leave questions down below. We answer these on a daily basis. And if you have a topic that you want to hear us dig into, just let us know. We have a very long list, but we can prioritize those things which we see the most feedback for. And I know I said lastly before, but actually, lastly, if you want to learn more about how we manage osteoporosis and you want to be able to ask questions to myself and potentially our team, look for the link in the Masterclass below. The free Masterclass is a great way for you to interact with myself and our team, learn about how we manage osteoporosis and other things that you could potentially do on your own. Take a look at that. We do that right now on a monthly basis, and we're getting big numbers for that, and space ultimately is getting limited because we're capped at 500 people and we are approaching that number every time. So reserve your spot for that, and I'll see you there or somewhere else. I wish you the best on your journey.